So we know India is a very populated country and a lot of people drive motor vehicles. These are very common reasons of head injury, mostly in highways, because it is always a rush highways in India, and we believe that is the most common cause of head injury.
The common concept is helmet is only for the driver, not for the pillion rider.
Yes, that is very. I think this concept is in more prevalent in India because they believe they use the helmet only for legal purposes. They use the helmet, but they don't understand it is mostly for the protection of your skull, protection of your head. We see the alcohol consumption is increasing day by day. If the patient is unconscious, then you have to immediately call for the help and shift the patient to the hospital. Means the patient has some head injury and the patient has to be addressed immediately. What the people do, they keep on roaming around in different places, different small hospitals, whereby they lose time, because the time is the life. If you don't reach the hospital in time, then you cannot save the patient.
Hello, I'm Dr. Suresh Sapkota from Kathmandu, Nepal, and I'm here for the last 1 month, 1.5 months with Dr. Atmaranjan, basically learning biportal endoscopic spine surgery, the magic of biportal endoscopic spine surgery, and along with it, we have a long history of treating head injuries, stroke patients, and today, especially today, we are going to dive into the science of head injury. How does it happen? What are the precautions that we need to prevent ourselves and our families from getting a bad head injury and getting bedridden for the rest of the life? And how to transfer if anything happens inside homes or in the street, how to transfer safely, uh, give first aid to a head injury patient in these scenarios. So, hello, Dr. Atman.
Hello,
How are you feeling today?
I'm feeling great.
Okay. So you have been treating head injuries for last almost 10 years.
Yeah.
So what do you think is the most common cause of head injury in young people?
Young people is always a motor vehicle accident. So we know India is a very populated country and a lot of people drive motor vehicles, two-wheelers we call. So these are very common reasons of head injury, mostly in highways, because it is always a rush highways in India, and we believe that is the most common cause of head injury. Second most common is trivial fall from height, fall from mostly seen in children, as you were discussing. Children used to fall when they're playing on the roof and all. They miss it. Third most common is trivial falls, fall in washroom. That is more common in elderly population.
Elderly population, yes.
So, and the dimensions of head injury is definitely more in youngsters because of the speed of the two wheelers they drive and the impact caused by because highway are high velocity accidents. Second is this fall. Fall is also a very severe form of injury. It also affects your head and spine and other bones also. The third type is the trivial fall, which happens for the elderly people, washroom aggregate. Those are very common for elderly, but those are a slow progressive head injury, which may progress over time. So these are the three scenarios and most common causes.
Exactly. अब बच्चों में जो है most common cause is injury inside the houses. Like there are unsafe staircases where the kids get play in the stairs and they fall
Running
down.
and all.
And they fall from the stair on the side of the stairs. They come down to 1 or 2 floors down, and sometimes from the windows.
Window.
Especially if they find it bed near the window, they climb up and want to see outside the window, and that's a common scenario.
Very common.
Usually get.
Very
So
common.
another is pillion rider. The mother and father are in the same motorbike, and the kid is inside in between them. That's a common scene in India and as well as in Nepal also.
Okay.
So the common concept is helmet is only for the driver, not for the pillion rider.
Yes, that is very. I think this concept is in more prevalent in India because they believe they use the helmet only for the for the somebody the police will catch or something. For legal purposes, they use the helmet, but they don't understand it is mostly for the protection of your skull, protection of your head.
Exactly.
So using a good helmet with good protection standards is very important for preventing a severe head injury. Now, many people are saved. Now, chances of getting saved from a severe head injury is 70%, if you are using a helmet. Otherwise, if I say this, if you are not wearing a helmet, then chances of dying from a head injury is 70%.
Exactly. They say that up to 40 kilometers per hour speed with a helmet won't do much harm to the brain.
Yes.
So there are a lot of protective mechanisms that the God has gifted to us inside our head that protects our brain. So besides that, we need to always wear a helmet while we are in a motorbike ride. So another thing that I notice is our roads are becoming more comfortable for speed driving. There are straight roads, 6 lanes, 4 lanes roads everywhere. But similarly, the cars and the motor vehicles are getting more efficient in driving. So
Because
high
as
speed.
the reason for high impact velocity accidents is because of the speed bikes. Now, with evolution, the bikes are getting now very powerful engines, which they can drive for higher speeds.
Higher speed.
So chances of surviving a severe motor vehicle accident is
Getting less.
getting less.
And on top of it, our kids and the youngsters are getting into alcohol and all the drug abuse that is going on.
Yes.
So the most of the time, the traffic checks only for breath analyzers for alcohol and cannabis and all the drugs. It's already left behind.
Left behind.
And
True.
it's not for the traffic or the police to maintain that rule. It's for our kids, our youngsters. They need to really get into this thing that if a head injury happens with alcohol intoxication or anything.
Alcohol intake is most common cause. Now we see the alcohol consumption is increasing day by day because of the lifestyle modification by people. Now people are more attracted to this alcohol club culture or pub culture, we can say, and after late night they start driving. Now, the point is, one thing is, if they meet with accident, you cannot assess a patient with head injury, because anyway, alcohol also causes neurological symptoms, dizziness, behavioral changes and all. So you cannot assess the patient of how severe is the head injury with alcohol. Right? You are confused, you are driving at your race and all, you cannot control the impact. Sometimes the people don't prefer wearing helmet after drinking alcohol. They feel the breeze on their face and all, just very they feel it's good, but definitely you should be saved to enjoy life. Right. So another thing is, one thing I want to mention is how we can suppose we normally the accidents are so common, so how we can prevent and how to because this is humanitarian ground, you have to help people who meet with an accident. So what to do? The first thing, we should ensure the safety of the accident victim. So otherwise, no, one person met with an accident, other vehicle comes and run over it, so leading to another injury. So first, we should make the patient to the safe ground. Like injured a soldier, you have to take them to safe ground first. Safe ground. Then you start the process of assessing and all. So second thing, what you assess is the responsiveness of the patient. That's how the patient is responsive. We can at least ask, who are you and what is your address, and the patient is able to speak about the name and address, means the patient is awake. If the patient is unconscious, then you have to immediately call for the help and ship the patient to the hospital. Means the patient has some head injury and the patient has to be addressed immediately. What the people do, they keep on roaming around in different places, different small hospitals, whereby they lose time. So time is very important. Suppose a patient is having intracranial hemorrhage, you have to shift him to a tertiary neurosurgery care center as soon as possible, because the time is the life. If you don't reach the hospital in time, then you cannot save the patient. Second thing is the responsiveness. If the patient is responsive, then you can assess other symptoms of the patient. Suppose the patient is another red flag is the patient is, if it is alcoholic. Alcoholic, then you have to immediately shift to the patient to the hospital and immediately do a CT scan, because you cannot assess the functions in an alcoholic patient.
So let's break this. This topic is very important, especially for a common man who sees an accident on the road, because either it's a common man or a traffic police or who walks in the street that sees that meets the accident the first.
First, yes.
So let's break it down for these people so that they can be aware when to take a person if some accident happens, when to take a person, rush the person to a hospital, and what kind of hospital, what kind of help that they should seek?
So the first thing is the responsiveness gives you a big understanding of the patient neurological symptom. The patient is responding to you, telling his name and address.
You mean if the patient is unconscious, then he should be taken to the hospital. There's
Yeah,
no other way.
no other way. Should be taken to the hospital because why the patient is unconscious? There must be some reason. The patient brain is not functioning the way it should function. Either the patient is addicted or the patient is not responding because of the head injury. That cannot be assessed on the road. So you have to take the patient to a tertiary care neurosurgery center. That is very important. And the second thing is you have seen in roads whenever the patient meet with an accident, the people will come and put water inside the mouth. Please drink some water, which is very important. We should not give any food or water to the patient victim who is lying down on the floor because of the accident. Some people come and they sprinkle water on the face. This should be prevented. And if you even at all, if you see some bleeding going on, some people will go and press the brain. Suppose there is a fracture in the skull, that will be more fractured. So gentle pressure if the patient is bleeding, gentle pressure is required. Do not give any food to the patient. Do not move the neck. Have you seen when the patient, they try to lift the patient, the head will be hanging like this.
Yeah.
They should be prevented. Some people will go and lift the bed, as you have seen in movies, Indian movies. Whenever the patient meets with an accident, they will come and lift the head first and give some water. Yeah, this has to be, no, this is strict no. Strict no, you should not give any water and do not follow these things from movies because suppose the patient is having a cervical spinal cord injury because of the eye motor vehicle accident and you lift the head, then the small injury is converted now to a complete injury, which is to be prevented, and most is very common. If you ask the relatives, they'll say he was moving his hands and leg while he was met with an accident. Now he is not moving the limb when he reached the hospital. So that is because of the transport issues. So do not move the head, keep it straight. Either somebody can hold from both the hands, somebody can. So now when you are lifting, two-person should lift the body and one-person should lift the head. And that we call as log rolls. We should not move the head in some other direction.
So if a person has some kind of head injury, then we should always remember that anybody touching that victim or the patient should remember that he might have a
Cervical spine injury, because
spine injury. So,
injuries never come alone.
yeah, injuries never come along, and it should be taken care of. So, of course, you have to protect.
And not only cervical, but also the dorsal spine injuries, the pelvic injuries, and the venous injuries. They has to be prevented.
So, for a common person, if we can break down this into the signs of head injury, that alarming signs of head injury, what would you say about it?
So that is we call as red flag signs. Whenever there is a head injury, what are things to be looked for, and you think this is happening, means this is something serious. One is a loss of consciousness. As we are saying, the patient is not responding to you, means the patient is unconscious. There is a high risk he is having some head injury. Maybe diffuse axonal injury or bleeding, whatever is happening, something is happening, something wrong is happening. You need to evaluate it further. Second thing is patient is having multiple bouts of vomiting. There is a head injury, but he comes and vomits and keeps on vomiting. So that is another red flag sign, because whenever there is pressure inside the brain automatically stimulates the GI tract to rage and vomit. Third thing is, if there is weakness of limbs, the patient has weakness of one side of the limb and not moving. He is having bleeding from nose and ears. And that is very important because that is also, it can be assessed by general public. When the patient is having nosebleed and ear bleed, that must be something serious, because without any fracture, without any severe injury, you cannot have a ear bleed. And if both are present, then definitely there is something abnormal. And seizure, if the patient is having fits we call is mirgi, fits, seizure, whatever you call, the patient is seizing after the injury, then it is a red flag sign. He is not able to respond to anything and completely lying down unresponsive. That is a very important sign which you should look into. And mostly elderly population and alcoholics. That is also another red flag sign which to be taken care as soon as possible.
There is another thing, another point that I would especially like to highlight about head injuries is the lucid interval.
Yes.
It sometimes masquerades as severe head injury.
Yes.
People succumb to it.
So that is why if the patient is awake, we should not take it for granted. Now, the point is if the patient is awake and you also suspect there is some head injury because the patient is having ear bleed or nose bleed, then you should maintain and observe him awake. Not this is very important for children especially. Whenever the children they have a fall, they used to cry and sometimes they become very drowsy. In those conditions, you should keep them awake. No, no, some people, the mother will say, no, no, he's crying to me, let her sleep, let him sleep. So which should not be done. You should keep the patient awake for at least 2 to 3 hours. It is what is lucid interval. So we should know what is lucid interval. It is most commonly seen in head injury where there is a extradural hematoma. The patient will be awake, the patient will be unconscious, again awake, and the patient will start talking everything as if he is normal, and suddenly he will collapse. So that is the pattern has to be followed. Pattern is he is unconscious first, then has a brief period of consciousness, then become unconscious and dips into coma. So that is very common. So patient is awake and unconscious means you should observe the patient. You should keep on talking to the patient. Where are you? What is going on? If the patient talks rationally and flawlessly, then it's good. If the patient start talking irrelevant, the patient you are asking the address, he's saying about the food. That means the patient is confused and says something fishy going on inside the brain.
So let's dive deeper into the science of head injury. Especially in the kids, we see that a kid falls down from a height or something like that happens. He has a little bit swelling on one side, and immediately he loses his consciousness for about half a minute or 1 minute, and then he regains his consciousness. He starts walking, but after some time, suddenly he becomes unconscious.
That is very common in children.
Yeah,
Lucid interval.
let's discuss the science behind it. We all need to understand.
So that is known as lucid interval. It is very common when with the extradural bleed, and no, the children and the when small children they have a fall and all. It's very commonly seen. So patient will be they will start they will lose consciousness again, they will start playing and again lose consciousness. So the very important thing which is known as lucid interval. Patient is loses consciousness, awake for a brief period, then again loses consciousness. We call it the lucid interval. So that is how why mothers should observe the babies when they have a fall for at least 2 to 3 hours and watch for vomiting, watch for any limb weakness, watch for drowsiness, and keep them awake. And sometimes on the patient is crying, keeps on crying, crying, babies are keeps on crying. That is also another sign which can point towards a severe head injury in children. So the first thing, well, especially in children, if they are having vomiting and the unconsciousness, unresponsiveness, they should immediately be brought to the hospital. And the laxity, the strictness is more for the children because they are more vulnerable. Their brain is new, the shaky, the bones are not formed in a well mannered fashion. Another thing is a depressed fracture, very common in children.
Exactly. So, with children or even adults, if somebody falls unconscious and regains consciousness after a head injury, then it's one of the red flag signs that you should get a head CT scan, or you should meet a
Unconsolable cry. You're trying to make the baby play, but he keeps on crying. That is another red flag sign.
yeah, in kids.
It's yeah.
So head injuries को हम intricate details में देखेंगे तो there are hematomas, and there are some other kind of injuries where generally a CT scan wouldn't show any much difference. Surgery is not being happening and the patient is already in the ventilator, not wakening up like for 4 5 days, 7 days. So these sort of injuries are basically known as diffuse axonal injuries. Let's hear about diffuse axonal injuries and why does this happen from the top.
So diffuse axonal injury is a kind of injury where you won't get any bleeding inside the brain. Mostly, if you have a met with an accident and you have some pathology, then you will get some bleeding in the brain. It can be SDH, you can be EDH, depending on the location of the bleed. But there is a very typical symptom which is not diffuse axonal injury. You won't see anything in the scan. Scan will be clear mostly, other than small bleeding at the junctional area with the gray white uh, junction, and those are considered more severe form of injury. These patients, because you cannot operate in this patients, we call it in Odia dahi chawli gala. So it means it's like a curd which is mixed. You can consider the brain matter, the chemicals and everything was mixed up like a khichdi inside the brain, and outside you don't get anything, which is known as diffuse angular injury. So diffuse angular injury is a severe form of injury which may require prolonged hospitalization, because again the chemicals coming back to the normal state takes time, because it's not like a bone. Brain is not like a bone which heals in within 15 days, 1 month time. It takes a lot of time, because to get those chemicals back to function. Then diffuse anxiety, most common cause is the shearing, because whenever the bone starts, this is the brain. Suppose it is covered by a covering which we know as calvaria or the skull bone. When this moves, the brain stops, the bone stops, but the brain starts moving, and it get mixed up because it's a soft structure. So which we call a diffuse angular injury. This is very important. One of the very challenging head trauma thing, because you cannot operate. You have to keep on medically managing the patient for a long time, but they do come back very good if you they come in time. And the ventilation is a very important aspect of head injury. If the patient is unconscious, you have to understand, some people when they put the patient on ventilator, they starts panicking, but most of the times airway protection is a mainstay of treatment in head injury, because if you maintain the oxygenation, now what happens whenever the patient meets with an accident, the patient becomes unconscious and the tongue falls back, causing the airway to obstruct. No, the tongue is a flappy structure which falls back and covers the airway. So the patient cannot breathe, leading to secondary injury, because it is like suffocating somebody because of the injury. Because the tongue falls, the airway cannot enter, the carbon dioxide builds up in the brain, making the brain more vulnerable to secondary injuries. So airway protection is very important.
When we are in peripheral center, गांव में कभी हम है और accident हो गया, तो a lot of time is being spent in local hospitals and here and there. So what is the meshes that people need to learn about?
So so head injury is not a small thing. It is not a fever or cold which can be treated immediately by nearby hospital. That we have to understand. It needs specialized treatment or super specialized care for a head injury, because it belongs to the neurosurgical department and arena. So neurosurgeons are normally very few neurosurgeons in any particular place if you go. So you should take to the patient to a tertiary neurosurgery care facility, where you can have a doctor who can treat the head injury. The neurosurgeon is a doctor who treats the head injury. If you take to a place, they think and learn about where the patient will get the treatment for the head injury. So people, they once they meet with an accident, they will roam around the small hospital. The patient is lying down on the floor for 5 hours and no CT is done. Even we're not aware whether the head injury has happened or not, whether there is bleeding or immediate neurosurgical intervention needed or not, that has to be assessed. So immediately if you're a bystander, if you think the patient is having a head injury or some relative had a head injury, you should have the call center number or something, or emergency number for any of the tertiary care hospital where neurosurgery facility is available, and immediately ship the patient directly to there, so that a CT scan and the airway maintenance is done in time. Once the airway is maintained, CT scan is done and you assess the head injury completely, then you can manage accordingly whether the surgery is needed or conservative management is needed. Small bleedings can be managed very well with medicines and physiotherapy and in medical treatment. But sometimes if the bleed is large and compressing the brain, in those cases immediate decompression. Decompression is, you have to understand, the brain is like a pressure cooker. It is covered all around by the bone. So whenever there is a bleeding inside the brain, it causes pressure inside the normal brain. So some part is there is bleeding and some part the brain is normal. So what the bleeding will cause? The bleeding will start pushing the soft brain material. So if you don't remove that bleeding in time, the patient will die because of the secondary brain injuries. The similar thing also happens in the stroke also. There is a bleed inside the brain, hemorrhage or a brain bleed, the brain will start pushing the bleed will start pushing the normal brain, and they damage the normal brain, which is more dangerous than the primary impact caused by the accident. So that is very important. Take the patient immediately to the hospital, protect the airway. The airway has to be protected. So, and the external bleeding has to be controlled in time.
External bleeding controlled, make the patient breathe, control the airway, and immediately rush to the
That's why
CT
CT scan can be done.
So, diving deep into this head injury, there are a lot of different types of head injuries. What happened? Head injury for a common man is just a head injury. एक आदमी चोट लग गया तो head injury. पर उसके treatment में और different type भी है उसमें. So maybe we can highlight this thing in a simpler form.
So a head injury can be see, this is a brain and it is covered by the bone. So God has given us a helmet already. You need another helmet to just to protect that helmet. That's the point. So the bleeding can happen inside the brain or outside the brain. If it is happening outside the brain, inside the skull bone, then it is a extradural bleed. It happens outside the bleeding. That happens, and this is a very potentially dangerous and curable simultaneously like this. If you remove the bleed, the patient will be immediately regains consciousness and becomes normal.
Say this, the brain is normal. The dura is the covering of the brain, and the in between the covering of the brain and the small bone, there is bleed. So
That we call an extradural bleed.
So these are relatively simpler
Form,
but they need urgent
treatment because this bleeding, because it is outside the brain, it will compress brain more if it's not taken care in time, and this is more rewarding also if you treat, and that is why the golden rule is important, because you should take the patient and immediately remove the bleed as soon as possible. Second thing is a subdural bleed. It is inside the calvaria but little deeper. So subdural bleed is bleed exactly on the surface of the brain. Extradural is outside the surface of the brain. Subdural is just on the surface of the brain, because the blood not only compresses the brain but also irritates the brain. That causes more secondary damage than the subdural brain. Third kind of bleed is the contusion. Contusion is that happens right inside the brain.
Talking about this brain tumors can ऐसे डर भी लग जाता है, पर it's not a thing.
Brain tumor सुन के बहुत लोगों की they understand start fear is the next level in if you somebody understand my may, and बहुत सारे patient इसीलिए headache के साथ हमारे पास भाग के आते हैं कि मुझे brain tumor तो नहीं हो गया.
Yeah, exactly. Tumor can say it's not always cancer. So most of the brain tumors are benign tumors. If you treat them on time, then there is no deficit. It cures for the rest of the life. So only few percentage of the tumors will be brain cancers, especially. So doctors tend to call all the tumors, all the things that grow inside the brain is tumors, but majority of them, they are benign tumors. So let's ask Dr. Atman about how to recognize what are the hidden signs of brain tumors. The hidden signs of brain tumors that anybody needs to understand.
So that is why important is hidden signs. People think it to be normal signs, like somebody changing behavior, and you think it is happening because of stress. That is not a sudden change in behavior. He suddenly is not talking to people. He is doing irrelevant talk, and person having scolding people like anything. He used to be a calm person. So those are some of behavioral changes which people think he may be getting some of the stress, or maybe he's getting old. That's why he's having these issues. So it should not be ignored. Sudden change in behavior, sudden change. The patient was behaving normally previously and he is aggressive person previously, then it's fine. But he was a calm person, now he starts behaving abnormally, then it's maybe there's some neurology, not only brain tumor, that will happen in multiple changes, but this can be a symptoms of brain tumor. Second thing is vomiting, especially in vomiting without any warning. Whenever the patient feels vomiting, he will feel nausea, he'll feel like vomiting, then he will vomit. But in brain tumor, they will directly vomit, there is no nausea. There's no feel like vomiting, they will directly vomit. We call it projectile vomiting. Some people will think the patient is having acidity or some gastric issues and they will ignore. And this is very common. That is one of the hidden symptoms. And this is most common is headache. Headaches especially associated with this. I'm saying that headache is a very common symptom. 1% of the people will with headache will get brain tumor. Rest 99% are normal. Maybe migraine, maybe refractory errors. So if somebody is having headache, do not run to a hospital just to evaluate I may be having a brain tumor. But yes, if it is you are having a brain tumor headache along with this kind of vomiting.
So this headache, once we dive into this headache, The important thing is headache is so common, as you stated. Very common. Very almost everybody has had a headache in their life. So when to be aware of headache? How? What are the things that we look into headache that should prompt us to get a medical attention?
If you have a headache, do not panic. Mostly it may be a common headache. But if the headache is happening in the morning and the headache changes pattern, behavior, like it is associated with vomiting, sometimes it is very much, sometimes it is reduced, and it's constant. Every day you are getting headache. Migraine, you don't get headache immediate every day. Sometimes there is a trigger followed by headache. Mostly in the evening, migraine. But for brain tumor, it is morning headache. Morning you will have headache, and not only headache, you may have vision changes. You may have vomiting. You may have personality changes. This is what is to look. If you have all these symptoms all together, then consult a doctor. That is what the point is. Sometimes another thing is most of the time which we ignore about symptom of brain tumor is seizures. Whenever we say about seizure, it is not like the patient is seizing like this. We call in Odia Bata, and in Hindi we call it mirgi. So it is not somebody is having a mirgi means he is having shaking movement and all. It can have a silent seizure, silent fits. How the patient, especially if they have frontal tumor, they will fall from the bed in the middle of the night. And whenever the husband is sleeping or the son is sleeping, the mother gets up and sees the son is lying on the bed floor, and the husband and the wife will see the husband is lying on the floor. Maybe he has fallen because of some normal issues, but this can be a very alarming sign, especially in the middle of the night. So this has to be taken care. These are very common symptoms which are missed. Another thing is a visual blurring. So in pituitary tumors and all, especially the patient will have visual blurring. Visual blurring means they can see from the typically from the center very well. Especially women, when they cooking and all, they cannot find the sugar, dal, whatever is sitting there. They have to look and bring it. Mostly they will have issues when driving. You cannot see some person is coming from sides. You can only see the center part, and sometimes the headache will be there. The vision issues should not be ignored. Other one is a weakness of the hand grip. Now, sometimes the patient may have experienced weakness in the hand, and we believe the patient is generalized weak. That is why he is not having this grip weakness. It can be a sign of spondylitis also, but this is possible with brain tumor.
So I have a small interesting story about 70 years old 70 साल के एक grandfather. He came to my OPD saying he has difficulty in urination. He has a little bit shaky movements while he enters into the OPD and has some urinary problems. And most of the time he has been taking this uh, prostate medicine, which is most common cause of urinary problems in adults. But when it comes with this difficulty in walking, then there are other causes, neurological causes that cause these sort of symptoms. Let's hear about this, the signs of this problem in this patient.
So I believe cervical spondylitis is a very ignored disease. And people this spondylitis है तो ठीक है पेन हो रहा है नेक में पेन हो रहा है वो जनरल पब्लिक में अवेयरनेस ये है कि सर्वाइकल स्पॉन्डिलाइटिस मींस नेक पेन. But this can be so devastating for any patient. No, nobody is aware about this. Like you said, young, he is old age and thought of that having to repeated urination. Repeated urination is one of also a sign of cervical spondylitis, severe form. When you stage 3, stage 4 symptoms of cervical spondylitis, patient will feel that I feel like I'll always go to the washroom. They get up 3-4 times in the night and they keep running to the urologist in the view can having some prostate issues. It is a commonly known thing. But this can also happen with cervical spondylitis. When you counsel the patient and discuss about the symptoms, they will come with the pain. You ask, "Okay, do you have any problem in the urination?" They will say, "Nah, yeah, I feel like I have to go to the washroom all the time. I feel I cannot control it. I feel like I'll pee in my pants." It's very common in cervical spondylitis, which is missed. Another form is whenever the very typical symptom of cervical spondylitis is, as we think cervical spondylitis is a neck problem. But the peculiarity and the interesting thing about this is whenever you have stage 2, stage 3 symptoms, the pain in the neck will disappear completely. So whenever we try to explain that you are having a cervical spondylitis and these all symptoms imbalance while walking, difficulty in walking, slowness is happening because of a cervical spondylitis. They don't believe us. They will say, no, 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 we don't have any problem in the neck. Whenever what are the word cervical spondylitis, they will say, I don't have any pain in the neck. That is what is important, because in stage 3, you won't have anything in the neck. So we have to understand how these symptoms happen. So brain is the master organ which produces current, which because of which we are able to walk and move and run. Whatever work we do is because of the current produced by the brain transmitted to the body through the spinal cord and the roots. Suppose you have a compression in the neck. So what will happen? The brain will produce current and it will travel to the body through the neck. Once it is compressed, you understand, like a pipe flowing, water flowing through the pipe, if you compress it, what will happen? The flow will be reduced. So what will happen? The body, the current passing through the body will be reduced. So what will have? You will have imbalance while walking. You cannot control your muscles because the current is not going to the body. You will not able to grip objects. So frequently they will say, "Ki I'm not able to eat my spoon. I'm not able to close my buttons because the fine movements are gone, because you are not getting the current from the brain because it is compressed here." They will say, "Ki I am feeling generalized weakness. Generalized weakness. I'm not able to run fast or walk fast because I'm feeling very stiffness in the body." And some of the very peculiar symptoms of like spondylitis, you'll feel like you have applied Amrutanjan on the skin. The peppermint like sensation, burning is very common in cervical spondylitis, which is very commonly missed. And once it goes to stage 2, stage 3, you should consult a doctor. It's not like if you're having urinary symptoms, it mostly happen because of prostate issue. It can happen with cervical spondylitis. That's the message.
Exactly. Yeah, the patients, elderly patients with neck pain, especially with hand clumsiness,
Hand clumsiness.
difficulty in walking, and it's a peppermint kind of feeling in their buttocks or legs and hands. And then that's the cervical spondylosis. And early treatment of cervical spondylosis is magical, and they can enjoy the rest of the life easily.
Yes.